Hi, May is Osteoporosis Awareness Month. So let's talk about it. What is osteoporosis? Osteoporosis is a medical condition where our bones become brittle and they weaken and they're more likely to get fractured. So a simple fall where you would have just gotten up and dusted yourself now is going to result in a fracture. And we know that fracture can actually really decrease our quality and quantity of life, especially in older people and women. A fracture can really increase your morbidity and mortality. So avoiding fractures and keeping your bones really healthy is very important. Now, who gets osteoporosis? Men and women can both get osteoporosis, but it is definitely at an increased risk in women. This especially happens after menopause, around the age of 52. With a lack of estrogen, we lose bone mass a little bit faster and can lead to osteoporosis. And, a few years ago, as soon as a woman hit menopause, she would get screened for osteoporosis. Now the screening is a little bit different. We actually start screening at 65. So make sure that once you hit that age, you are getting screened. And screening is done by a very simple x-ray that looks at bone density at various points in your body, including the spine, the hip, and sometimes your wrist. Um, so what are some additional risk factors that put you at increased risk for osteoporosis? Certainly, as we mentioned, age, menopausal status, but genetics is another big one. So if you have a family history of osteoporosis, or your mom or your dad had a premature fracture, they fell, when they were in the 50s, 40s even, and they fractured their wrist or leg, that is an important piece of history. So make sure you have that. Also, if you're a smoker, or if you are very petite, or if you have a history of taking steroids for whatever reason for a long period of time. And I'm not talking about like topical steroids for the skin, I'm talking about oral steroids like prednisone. So if you've been on steroids for other medical conditions for a long time, that is going to make your bones weaker and you are increased risk of getting osteoporosis. So you want to be screened earlier, maybe even at 50 or 55. Um, what can you do to delay the onset of osteoporosis? Calcium, vitamin D, a very healthy diet, and definitely weights. So a lot of people are talking about cardio, running. When I see patients in the office, exercise is all about cardio, but make sure you're lifting the weights. Now, if you do have osteoporosis, there are excellent treatment options out there, including oral medications as well as IV medications. Please seek the help of a specialist who can help you with this. An endocrinologist is a specialist that can help you with osteoporosis and the treatment and going through the nuances of various treatments. So get out there, exercise, make sure you get screened. And